It's 1864, Kansas. Picture a grief-stricken father standing over the graves of 3 children who died from spinal meningitis despite receiving the best medical care of the times, like bloodletting, harsh drugs. This father's name was Dr. Andrew Taylor Still, and his tragedy was about to spark a medical revolution, but also sparks controversies that rage to this day. Some call parts of it quackery, while others swear it saved their lives. But Dr. Andrew Taylor Still was not just any doctor. He was a frontier physician, taught medicine by his own father, who was a self-taught doctor. Still had served as a hospital steward during the Civil War, reaching the rank of major. He had seen firsthand how brutal and ineffective 1850s medicine could be, when most physicians had no formal training and relied on theories like bloodletting cures everything. Gruesome, isn't it? Still didn't retreat into grief after losing his children. He rebelled. He began exploring the alternative medicine movements sweeping America at that time. Andrew Still became particularly interested in magnetic healing, the belief that invisible magnetic fluid flowed through the body and disease occurred when this flow was obstructed or disrupted. But Still's breakthrough came from combining these influences with something unique: manual therapy. By the 1880s, he was calling himself the lightning bone setter, believing that spinal displacement caused most diseases and that proper adjustment of these vertebral parts could restore health. On January 16, 1891, Still first used the initials DO and called his system osteopathy. That's what osteopathy was supposed to mean. Osteo standing for bones and pathology, or pathy standing for lesion or treatment. From outcast to mainstream. Still founded the American School of Osteopathy in 1892 with only 3 apprentices, calling it School of Bones. He was the sole faculty member, fancying himself more as a natural philosopher than an academic. His students only learned anatomy. In fact, Still considered physiology and other medical sciences unnecessary. The medical establishment called him a fraud and a charlatan. His students began achieving remarkable results with patients conventional medicine couldn't help. The word spread. By early 1900s, osteopathic colleges were established across America. The real validation came during the 1918 flu pandemic, when osteopaths outperformed conventional doctors. By 1913, 39 states in the US had recognized osteopathy. In 1917, John Martin Littlejohn, who was a student of Andrew Still, brought osteopathy to Europe, to London specifically, and founded what's now University College of Osteopathy. The British medical establishment was skeptical initially as well, but osteopaths kept getting results, 1 patient at a time. Then, in 1948, the London School of Osteopathy was founded, initially as a Croydon School of Osteopathy. This is where I'm studying. The controversy continues today. European osteopathy is divided between the devoted to Still's original doctrines, including unproven techniques like cranial, sacral therapy, and also visceral osteopathy, and those striving for evidence-based practice. The author of Osteopathic Historical Analysis stated, osteopathy doesn't cure disease. It improves mechanics, neurological conduction, blood flow, fluid flow, whereby healing processes can be stimulated, not more, not less. Fast forward to today, in the UK, osteopathy is now a regulated healthcare profession with its governing body called General Osteopathic Council. And osteopaths complete rigorous 4 to 6 years degrees. And I can attest to that. I myself just finished my 3rd year, and the training is pretty rigorous and time-consuming. From the first year, we study anatomy, physiology, neurology, in clinical pathology in depth, just like medical students. And then we have ongoing clinical practice from the beginning to the end. Today in the UK, many osteopaths work alongside GPs and other healthcare professionals. Professional sports teams employ osteopaths. The NHS recognizes osteopathy as an effective treatment for specific conditions, specifically musculoskeletal conditions, and it actually belongs to the umbrella of services called allied health treatments or allied health services. Modern osteopathic treatment isn't just about touch here, massage there, and that's it. It may look very simple from the outside, but there is a very rigorous process of justification of treatment and treatment selection happening, usually during the case history taking. That's why when you go to an osteopathic consultation, you may be asked questions that may seem irrelevant, because we are trained to see how everything in the body connects, from your nervous system, all the internal organs, muscles and tendons, and also your mind. Whether you're skeptical of some osteopathic approaches or you've experienced life-changing results yourself, the core insights remain powerful. Sometimes the body simply needs the right support to do what it's supposed to do, what it was designed to do, what it evolved to do. And personally, I believe it's about practitioners' knowledge, experience, and intention. My question for you is, have you experienced osteopathy or osteopathic treatment yourself? I would love to hear your honest opinions in the comments below, both success stories and also skeptical questions. If this got you thinking, subscribe for more videos and we will cover similar topics in the future.